Hi guys. Okay, one of the most popular requests that I get with Botox is a Botox brow lift. So what does that mean? Basically what that means is elevating the brows by using neuromodulators. So I've talked about this before, I've done videos about this before. This is something I'm personally very interested in because I have very heavy lids. I'll probably need an upper bleph at some point in my life. But for now, I'm helping to raise my brows with Botox. So there's a few ways that we can do this, but I'll walk you through some of the most popular ways and what I do for myself. So as we've talked about before, this muscle here, these muscles rather, so the corrugator muscles and the procerus make up the glabellar complex. The job of those muscles together is to pull your face in and down. Those are depressor muscles. Again, just to review, the job of the frontalis or your forehead muscle is an elevator. So whenever you're doing Botox, you have to think about when you decrease movement in those muscles, what is going to happen, right? Every action has a reaction. So if we're injecting in the forehead, we can expect that that's going to drop the brows, right? That's not what we're going for. So I personally really will never inject someone's forehead without also treating the glabellar complex. So if you are looking for a brow lift, we are going to inject, boop, 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 right? That glabellar complex. We really want to knock out that procerus and those corrugator muscles. We also can do 2 little injection points at the tail of the brow because that's going to give us lift here, right? And then of course, treating the orbicularis oculi because that's going to help pull this way, right? So those crow's feet. If you are also treating the forehead, which of course in most of my patients I do, right? They want to make sure they're treating their fine lines and wrinkles here. I am staying extremely high on the forehead, right? So when you're injecting or when you're getting injected, a great way to check is if you raise your eyebrows. If I inject here, push, 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 that's probably gonna drop my brow. So I stay very high on the forehead and I know that if I'm knocking out frontalis here, I'm probably going to be safe. So different injection points in everybody. Of course, we're gonna assess your individual anatomy, but this is a great way to get that lifted look without dropping the brow. Let me know if you have any questions. Bye.